Good afternoon, everyone. Thank you for your patience. We were just making sure we were getting a couple people settled in the different locations. This is Cindy from the Parkinson's Resource Center here in Spokane. Hello, everyone. I should take my sunglasses off. And welcome to June's Parkinson's telehealth program. Today we have Dorreen Nicholas, who is going to be giving us an example of a speech therapy session. We're really excited to have her. A couple of maintenance real quick for Spokane and the other sites. If you noticed, your postcards, if you received them, are a little different this month. We had some trouble with the mailing list. So if I have a request for everybody, if you didn't receive a postcard and you want to receive a postcard, please contact me at the Parkinson's Resource Center, because we're still working on the troubles with that mailing list, and I want to make sure that everybody is getting the information for the telehealth that wants it. And you can contact me at 509-473-2490 or by email at center@SpokaneParkinsons.org. Or if you did receive the postcards, there was an extra one in there that you can hand off to other people if they wanted more information. Let's see.
Cindy,
Yes.
would you remind our viewers to please mute their mics unless they are trying to ask a question? We have a lot of open mics out there.
That's what I thought. I hear him. It's kind of fun to hear everybody talking. But yes, we are just about ready to invite Dorreen up. And so if you have an open mic, please go ahead and hit mute on that right now. And as always, we want to thank Northwest Parkinson's Foundation for their help in bringing this program to all the sites that we broadcast out to, and St. Luke's for housing us for our presentation site today, and Northwest Telehealth always for their help, and everybody else who supports us. So I'm going to turn it over. I'm going to get out of your way and turn it over to Dorreen so we can get educated about speech therapy.
Okay. Can you hear me? Okay, good afternoon. Good afternoon. Did she mention I was a speech therapist? So that's your cue. Okay. Cindy asked me to tell you a little bit about myself. I'm a speech language pathologist, and I've been practicing for about, I don't know, do I want to say 28 years. I've been teaching and working as a clinic director for Eastern Washington University for 18 years, educating graduate students. And before that, I was at Sacred Heart in St. Luke's, actually, working with adults in speech language pathologists. So came by way of Butte, Montana, and here I am in the wonderful city of Spokane. So, okay, so what is a speech language pathologist? I thought I'd tell you just a little bit. I don't know if a lot of you think of us as just maybe doing our tick in the schools, but we really have a wide range of what we do. And so we are treating children and adults, infants, newborns, all the way through the lifespan with speech and language deficits, fluency, Parkinson's, multiple sclerosis. We're working on augmentative communication, voice, executive function skills after traumatic brain injury. We have a wide scope of things that we work on as speech language pathologists. And you're here today mostly to hear about voice, what we do for voice therapy, and a little bit about swallowing. So a speech language pathologist requires a master's degree, and then we typically have a certificate of clinical competence as well. So about 6 years of school. Okay, so a lot of you are here with caregivers today. Now, has your caregiver said to you in the last week, I didn't understand you, what did you say? Anybody have that happen? Are you going to raise your hand, Roy? Yeah, okay. And Shirley, Roger, you had that happen? So we know that with Parkinson's, your voice tends to get softer, okay? So So some days better than others, right? Some hours better than others, okay? You might feel really hoarse or scratchy. She's getting the elbow back there. And it's going to sound somewhat slurred at times, which is what we call dysarthria, okay? So your voice tends to get softer with Parkinson's, and it's not that you don't have the ability to be louder, but your perception of what is normal starts to change. So what we do in speech therapy is we try and change that perception of what you feel is normal, okay? The other thing that happens is you get kind of that mask-faced face and you lose some of that expression, okay? So not a lot of smiling, not a lot of eyes. And some people may perceive that as that you're not interested, right? Maybe that you're bored. And so we hope that as we do some of this therapy, we can get a little bit more expression in your face, because we do know you're paying attention, but that's one of the symptoms, okay? And certainly a lot of weakness. Okay, what about swallowing problems? Anybody having some swallowing problems? Okay. Maybe coughing when you're drinking liquids. Maybe the sensation of something sticking in your throat. Okay. My mom has Parkinson's. Her speech is actually very strong, but she has a lot of swallowing problems, and that really was probably one of the first symptoms that she had. So our hope is, as we do some of this voice therapy, your swallowing problems will get a little bit better. Okay. So we know that about 90% of people with Parkinson's are going to end up with some voice disorders. Sadly, less than 5% are getting therapy. Okay? So at some time along this progression of this disease, you're going to have some voice problems, but not very many people are getting therapy. And we really have a lot of evidence that therapy helps. So I hope to show you a little bit of that today. And then, of course, a lot have swallowing difficulties as well. Okay, so in front of you, you have a sound level meter, and if you hit the little red button on it, oh, you brought your own. Look at this. You must have had speech therapy. Okay, everybody have it on? So what kind of readings are you, if I stop talking for a second, just look at what the reading is in this quiet room. What numbers are you getting? 47 and 48. Pretty loud in here, isn't it, with this fan going and these fluorescent lights. And that's one thing you need to keep in mind is when you're talking, you've got to be thinking about what the noise is in that environment so your communication partners can hear you. Okay? So who wants to give it an ah a try? You want to just say ah nice and loud and do a measurement for me? Try it. Ah. What was the reading? Okay, not bad, not bad. Okay, anybody else want to try? What was your reading? Go ahead and try it again. Hold it a little bit longer so you can get it. Oh, okay. What'd you get? $60? Okay. All right, give it a try again. Oh, that's really good. 93 is good. Okay, so probably if I wasn't standing here as your cue that you should be doing some speech therapy and talking louder, many of you are going to be in the low 60s and 50s, okay? Keeping in mind that what did we say the noise level was in here? 48. It's masking it, so you really are going to have to bring that loudness level up, okay? All right, so what I want everybody, we're going to do this together and keep an eye on your sound level meter. Now, keeping in mind that it's really going to record the loudest person around you. But let's go ahead and count 1 to 20. You ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. What kind of readings were you getting? 60s and 70s, 79, yeah, 79, yeah, and it's going to record who's ever louder around you. It's going to make a difference how far it is from your mouth, right? Okay, so now I want you to try it this way. We're going to start with 20 and we're going to go backwards. Okay, here we go. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Did you notice anything different about the two? It was slower when? When you counted backwards? Did you go slower? Okay. Do you think you were louder or softer when you did He was louder. Okay. You were louder when you counted backwards, right? Okay. So that is how this whole therapy approach got started. So in the 1950s, Dr. Daniel Boom, who is a speech-language pathologist who's in his 80s now, and actually I get to meet him next week. I'm very excited. He figured this phenomenon out, that when we count backwards, it's more intentional. Okay? Yeah. So when we're counting forward, we tend to count, we're not really paying attention to it, and we just roll the numbers off. But what he saw was when we count backwards, we speak with a lot more intent, okay? That we're talking louder. So thus, this whole approach to how to deal with some of these slurred speech or dysarthrias, and especially Parkinson's, was born. Okay, makes sense? Okay. So from that, over the years, and I know you've probably all heard somewhat, a little bit about the Lee Silverman voice treatment approach. And that is an approach that's had lots of research, a lot of evidence-based practice done on it, and clinicians are actually trained and certified. I have gone through the program. And that is a result of Dr. Boone's research and findings about speaking with intent. And then also as well, the Parkinson's Voice Project has a program almost like the Lee Silverman, same thing, speaking with intent. And actually next week, myself and 3 of my colleagues are going to go to Dallas to get certified in that program as well. So we're real excited about that. And we get to meet Dr. Boone. So what they have found from these treatment approaches that your speech is clearer, your voice is louder, okay, and you're more understandable, okay? And then they also have found, even though it's not treating swallowing directly, that swallowing, people report swallowing is improving, okay? It makes sense. We're strengthening the same muscles. Okay. So what treatment does is we're looking at changing your perception, because you think you're talking loud, but you're not. Okay? So, do you feel like I'm talking too loud? No? Do you think I'm talking too loud? No? Okay. Do you think I'm talking too loud now? We rehearsed this all before we got here. No. So I'm talking around 67, 72 decibels, and it doesn't seem too loud, okay? No, it doesn't. But so what we need for you to do is get that sensation of that louder voice. Feel that effort of that louder voice so it's more normal to you, okay, on a daily basis all day long, because it's not too loud. You think you're shouting and you're not shouting, right? Right? Right. Okay. Okay. So we're going to run through a basic treatment, a little bit of our treatment in a minute. I just want to tell you that based on the Lee Silverman treatment approach and the Parkinson's Voice Project, it's very intensive, 4 weeks, okay, 3 to 4 times a week, depending on which program, and it's 45 to 60-minute sessions, okay? Okay, the only cue I'm going to give you is to be loud, okay? Speak with intent and be loud. You know, it's so foreign to us. We're always thinking we should be quiet, okay? We want you to get that new sensation of what's normal, okay? All right, so each session starts with, we're going to do some ahs, we're going to do some highs and lows. Gosh, I'm glad the music therapist is here today. You'll really appreciate that. And then some counting, some phrases, some reading, some different activities to actually practice that loud voice, okay? One thing to keep in mind when you're doing this, and even throughout the day when you're talking a lot, is you got to drink a lot of water, okay? Got to stay hydrated. Okay, so everybody ready? Now your sound level meter may time out on you. You'll just have to hit that red button again, okay? So if you came into my office and we were going to start our speech therapy session, the first thing we would do is we're going to do some loud ahs, okay? So you're going to watch me. You want that sound level meter 70s, even low 80s, all right? So whoever is the loudest around wins, but just watch me and do what I do. You ready? Okay, so you want to hold that ah as long as you can with good quality, okay? Good quality is your first focus. You work on holding it longer. So if you start to get a little gravelly, like ah, you want to stop, okay? So good quality, all right? Ready? We're just going to be loud, right? Here we go. All right. How's everybody doing with that? Who wants to try it all by themselves? Roy. His wife says. Okay. So let's watch your sound level meter. Okay, you ready? Nice and loud. Here you go. He's been coming to treble clefs. 88. Does he talk that loud at home? Okay, anybody else want to try it? Shirley's going to try it. All right, here we go. How loud? 92. And I don't even need to ask if you talk that loud at home. We spent a few days in Palm Springs last week together. I'm like, okay, let's do it all together again. Here we go. It should feel like you're working, right? No different than weightlifting. You should feel it. So when you come to therapy session, we do 15 of those. That's your calibration tool. So as you go through the day and someone says to you, I don't hear you, you can do that. You know, either even in your own mind, but maybe you're going to go to a presentation and you're going to do the speaking and you're driving in the car, do your loud ahs. That's what you want to hit, is that nice loud ah. Okay, that's your calibration. So if you're coming to therapy, you would do 15 of those. Okay. And the next thing that you do in therapy is we're going to go up the scale. And the reason we want to do that is because your voice with Parkinson's can tend to be very monotone. And so we want to work on that scale so you get a lot of interest in your voice, right? Okay, so we're just going to start low, and you're going to go high. Okay, ready? Here we go. Ah. All right. You only have to hold that one for about 5 seconds. You may not be as high as you can get to today or tomorrow or the third time, but you're going to get more pitch range. Okay? Here we go. Let's try that ah from your normal to the high. Ready? Ah. Okay? You want good volume and good quality. Okay? Let's do it again. Ah. Are you surprised you can get a pitch change? Okay. So if you were coming to therapy, we would do 15 of those. I can't sing. Sorry. Okay. Then, of course, because we did our highs, we got to do some lows. So you're going to start here and you're going to go down. I don't want you to drop your chin, okay? Just keep your head neutral. You're going to start at your normal voice and go down. Nice and loud. Here we go. Ah. Harder for the women, easier for the men. Okay. Keep your volume up. Here we go. We're going to go down the slide. Ah. Ah. Okay. How's that working for you? Didn't know you could sing. Okay. Try it one more time. We're going to go from your normal down to the low. Ah. Okay. If you have anything to drink, take a drink. Okay, so after we do lots and lots of ahs and highs and lows, we want to start working on some speech tasks, okay? They can be variable what we're going to do, but we're going to go back to our counting today. And what I want you to think about is throwing your voice over my head, okay? So pretend you're up here speaking. You want to keep that volume up. Okay? Here we go. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Did you throw your voice up over my head? Okay. All right, who wants to try it all by themselves? You want to try it? No? Nobody's looking at me now. want to try it? You want to try it? How about just till 10? I'll do it with you. You ready? Okay. 1, 2, 3.
4, 5, 6, 7, 8, 9, 10.
Awesome. Okay. Does he usually talk that loud? Is that how loud he talks? No. Okay. So you just have to be thinking about using that loud ah voice throughout your day. And when you come into my session, I try to not let you get away with ever using that soft voice. So if I say to you in the middle of the ahs, how was your weekend? And you say, fine. I say, what? I'm an obnoxious cheerleader. All right, how's our remote locations doing? Are you singing along with me? Okay. All right. So we could also do some days of the week as some of our practice exercises. Let's try some phrases. Now, when you do these phrases, I want to make sure you get some of that inflection into your voice, okay? So you're going to overdo it. You're going to pretend you're on the stage. It's not just going to be hello. It's going to be hello, okay? Are you ready? Throw that voice over my head. Here we go. Hello. Oh, that was perfect. All right. How are you? I'm fine. Good. Good morning. Thank you. You guys are quick studies. Okay. Do you want some coffee?
Yes.
Okay. Yeah, I like it. Let's try it. Do you want some coffee? Give me the remote, please. Anybody say that throughout the day? Do you say it that nicely? Oh, yeah. Okay. How about this one? It's time for my pills. Where are you going? I'd like steak for dinner. Okay? So what I ask you to do when you come to therapy is to come up with your own phrases that you use every day, and we work on those for those 12 to 16 sessions. So you get to pick some of it. How's everybody doing?
Good.
How's everybody doing?
Good.
I like it. Oh, we got to do that loud ah voice. Okay, so another activity that we do on Thursdays at 1 o'clock at the University Hearing and Speech Clinic, we actually have a speech group, and we do the same things here, and we read poems or maybe the newspaper, but we also just read through some Dr. Seuss books. Now, why do you think we do that? He repeats the words a lot. It rhymes.
Rhythm.
Lots of rhythm. It's simple, yeah.
It's fun.
Yes, it's fun. Yeah, and we pulled up some old book Dr. Seuss stories. But it's got a lot of melody, right? So we'll read those together or separate. So we're going to try a little bit of that today. But you've got to put some of that oomph into this, right? It's got to be up, up, okay? So let's give a Dr. Seuss, couple lines of the Dr. Seuss story. I think I've got 3 slides, okay? You ready? Here we go. Up, up, the sun is getting up. The sun gets up, so up with you. Ready? Up. Ear number 1. Ear number 2. Up, heads up.
Up, up. Great day today. Great day for up.
Good. Okay, here we go. Up, up.
You open up your eyes. You worms, you frogs, you butterflies.
Ready? Great day for upbeat, lefts and rights, and up, baseballs, footballs, kites. Keep it loud.
Great day to sing upon the fire.
Up, voices, louder, higher. You guys are good, quick studies. That's excellent. Feel a little strain, a little effort there? Okay. So now I'm going to add a little cognitive piece in case you're falling asleep. You're going to have to do a little thinking here today. But again, we're trying to incorporate something where your mind might be thinking, a little bit different about what the opposite is, but we still want that loud voice. So this might be something we do in therapy as well. Okay? Again, you want your ah voice. Okay? So let's run through these. Ready? Black and
White.
up and
Down.
in and
Out.
mother and
Father.
sister and
Brother.
short and
Tall.
big and
Small.
hot and
Cold.
rough and there's no wrong answer. So you know. Are you still using your loud voice? Yes. Okay.
Yeah.
Yes. And it's hard work. All right. So you come to therapy 12 to 16 times, and you do this for 45 to 60 minutes. You're probably tired. Okay. Your voice is probably tired. I know mine gets tired. In addition to that, you have to do homework. Okay. So if you come to therapy, on that day you would go home and run through your homework, which is about the same thing, your ahs and reading your phrases and maybe reading the newspaper once a day. On the day you don't have therapy, you would do this twice a day, okay? So you've got to put some work in too. And really, you don't even need a sound level meter, but I don't know, I'm one of those people who like to take all the measurements. I'm a speech therapist, for goodness sakes, I like to take the measurements and write it down. But you can get a sound level meter app on an iPhone, or you can get a sound level meter at Radio Shack for $50. But it doesn't take much. Mostly it takes really thinking about sitting at your kitchen table having dinner and using that loud voice, okay? Or going out to eat in a noisy restaurant and using a louder voice, okay? Driving in the car. So you have to put in some work with homework as well. Again, we have to train your ear that you're not shouting. You're going to feel like you're shouting for a while, but you're really not shouting. Probably where you're talking is in the 60s, and that is not too loud.
I got mine for $20.
You did? You'll have to give me that website. Yeah. Yeah.
They're handy when you're talking on the phone. You want to make your voice loud.
That's right. If you could have it by the phone, I've told my patients to have it at the kitchen table or the dining room table. I have a patient who does a lot of speaking. He's in a lot of volunteer groups, and so he'll actually put it up on the podium to remind himself to use that loud voice, okay? But I think, it just makes such a big difference. I remember at the beginning of the year, and I teach graduate students, and I had a brand new graduate student come in, and we had a new patient. And he actually heard me speak at the Hope Conference. I don't know if any of you were there. Some of you were there. And this gentleman walked into my office like this. And I thought, oh my, he doesn't look very happy, okay? And, head down, probably through the first 20 minutes, and I really had to work to get a good, strong awe from him. I had to have him do some pulling, and we were, doing a little bit of pressure, trying to get a good awe. And we went through the session, and when he left, I don't know if I've ever felt like I did such a great job as a therapist in 1 hour as I did that day. And my student was just in awe of me, like, because he left like this. And he had a smile on his face, and he was talking loud, and he was, giving it back to me as quick as I could give it to him. And you know what? He changed all our lives that day. He changed my students, he changed mine, he changed his spouses, and he changed his. And it just, if you can communicate so people understand you, your whole world changes, right? So that was really my aha moment as a speech language pathologist, and I've been doing this a while. The other way I think, you could do homework as well, and I would encourage to do the speech group, but also to come to tremble class or just sing. Sing in the shower, sing in the car, use your loud voice. Sing if you play the piano, Use singing because, again, we get such great pitch changes with that, and then you're going to sing louder. But you want to use that nice, loud ah voice, okay? So let's try that ah again. Okay, you ready? Ah! That's what you want to hear. And remember, even if you're going to go home and practice this, that's great. If you get that gurgly quality, stop. You want to get good quality. We'd rather have it louder for a shorter amount of time, and then you can work on holding that longer, okay? And that's all there is to it. It's pretty darn easy, but you've got to do the work, and you've got to train that ear to know that you're not really yelling and to get that sensation that you're not yelling out of your head. Okay? Any questions for me? You have questions?
This part, if you're done, are you done with your
I am done.
Okay, well, we're going to go around to the 21 sites now.
Okay.
Because this is, are you going to talk about this too? Do you want to talk about that real quick before we start?
Okay. So over the next year, I actually got 2 grants, one from the Empire Health Foundation and one from Eastern, to work with patients who have Parkinson's and actually take this therapy to some rural areas. And I hope that with these 7 counties that we can do somewhere we'd actually go to these counties, and we can do some therapy and maybe singing and speech groups, and also start doing some telehealth back and forth. But my goal is to hit about 50 patients in the next year, starting in September, with some of this grant money. So it's funded some materials, some mileage, things like that. So that is my goal, that we can reach out across Eastern Washington. Yes, Roger.
One thing that you mentioned that I think is very important is taking your breath, knowing when to do it. And another thing, when I speak on the phone, as I have one of my work now, over it, the feel associated there when you ring the card, or you're not too bright, and then they wanna talk to somebody else. And that hurts your feeling. If we can educate the people, I even tell I have fun.
Yep.
And I have trouble sometimes speaking clearly, and they just let me
Mm-hmm.
I have a different knowledge, eating wrong, and taking all the time to eat.
Yeah. So you
Eating pills,
taking pills? Yep. So your first comment was I didn't talk about taking a breath, and it depends on if it depends on the patient. For most patients, if we only cue to be loud, I don't need to talk about breathing, because what happens when we yell?
Take a breath.
We take a big breath. And what really the treatment, why they figure this treatment approach works is because we're only telling you to do one thing. Okay, we're not saying sit up straight, take a breath, make sure you over-articulate, speak loud. You know, we're just telling you to be loud, because when you actually go to do your ah, you do all those things. But there are some patients, yes, that I do have to back down and work more on that breath. And then your other comments we're talking about, especially on the phone when you talk to people, they assume that you're not of average intelligence, and that's really difficult. And I think it does make sense to say, yes, I do have Parkinson's and I have trouble speaking. Yeah.
And then hopefully get to talk to Dorreen more and take more speech therapy.
Yeah.
And so what we do at this time, Dorreen, is we'll go through each one of the sites,
Okay.
and we'll see if they have any questions there.
Okay.
So if you are ready at our other sites, Anchorage, I would love to know at each one of the sites how many people you have and if you have any questions.
We have 5 people.
Thank you.
You hear me?
Yes.
And I have a question.
Okay.
Are there problems that people have that have deep brain stimulation that are different with speech than ordinary people with Parkinson's?
Can you repeat it one more time? It was cutting out just a little bit.
Right. Do people with deep brain stimulation have different problems speaking, and can they be helped by Lee Silverman training?
Deep brain stimulation tends not to help the speech. And then sometimes it might make it a little bit worse. But yes, you can certainly do this type of therapy with somebody who has deep brain stimulation. Did that answer your question?
Yes.
It's kind of, deep brain stimulation is going to help other motor problems, but sometimes doesn't do much for the speech.
We just had a speaker at the Women with PD the other day, and there's actually a couple different kinds of DBS, deep brain stimulation surgery, that you can have, and one may not affect the voice as much as the other. So when you're going into that and considering that DBS, that's one of those things, if you already have speech issues, you might also look at which one you can do and talk to your doctor about that. Thank you, Anchorage, very much. Let's go to Chihuahua. Clarkston Tri-State Memorial.
Yeah, hi, Cindy. Having a good program today. We're making lots of noise here.
Yay!
I have a comment and then 2 questions. Anybody with a smartphone can download a sound meter app. I did it while you were talking, and I had 5 or 6 of them that came up for free. 2 questions. We didn't see Asotin County on your grant list. So is there something available down in this area, like the Lee Silverman Big program, for example?
Now, the Lee Silverman Big therapy is actually the physical therapy part of it. But are you asking about the Lee Silverman Loud?
I want to know about the big physical therapy.
Our question, I guess, is about the big therapy, but I have a question about any kind of speech therapy like you're doing that would be available as well.
So you can go to the Lee Silverman Voice Treatment website, and certified providers would be on that, and so you should be able to see if there's somebody in that area that has been certified. Or as close as you are, you could find
Is just LeeSilverman.com, something like that?
Yeah, Lee Silverman Voice Treatment, certified providers.
I'll find it for you, and if you get a hold of me, I'll find it for you, and if you don't find it, and we'll look on it together.
Okay, thanks, Cindy. I think we can probably Google it.
Yeah. 19.
There are 19 here today.
19. Thank you very much. Okay, Coeur d'Alene, Idaho, Kootenai Medical Center.
Yes, we have 8 here now. We did have 10. Does anybody have a question? No questions.
And you guys have, I'm sure you have providers in Coeur d'Alene area.
Thank you for coming, Coeur d'Alene. Colville, Providence, Mount Carmel. Dayton General Hospital. Grangeville, Idaho, Syringa Hospital. Kennewick General Hospital. And if I go too quick and I skip you, let me know. Kirkland, Evergreen Healthcare.
We have two people now. May I ask a question about slurred speech?
Okay.
I have slurred speech at different times during the day. Sometimes it's completely clear, sometimes it's slurred, but it's not all the time. It varies. Any ideas?
Well, yes, it could. That makes sense to me. We certainly see that. It could depend on your fatigue level and possibly your medication, if you're having any on and off symptoms. But, you know, we talk a lot about if you have to go maybe give a presentation for lunch or you have a lunch meeting, you might want to think about conserving some of your energy in the morning, even as far as taking a shower and shaving. So yes, we certainly do see that up and down throughout the day. So those other times is when you'll really have to think about kind of using that loud voice.
Thank you.
Thank you for attending today. Miles City.
Yes, this is Miles City, and we have 6 people and our dog Shadow.
Welcome.
And I was wondering, with your voice therapy, if reading aloud would be a help for people.
Absolutely. I have people reading the paper aloud, they're saying their prayers aloud, anything where you're talking out loud.
Well, my prayers aren't that long, so I'd have to read the paper, I guess.
Okay, you can
Thank you very much.
Say a prayer for me.
I'll do it.
Okay.
Thank you.
Thank you very much. Moses Lake Samaritan Healthcare.
Yeah, there are 4 of us here today. I don't believe there's any questions, but thank you for the informative program.
You have a nice voice.
Thank you.
Thank you.
Thank you for being there. OMAC Mid-Valley Hospital. I don't think there's there. Pendleton, Oregon.
There's only one here today.
Thank you for coming today. Do you have any questions?
Oh, I turned you off.
Okay. Pullman Regional Hospital.
There are 3 of us here today. We have one question.
Okay. Go ahead.
Would you speak a little bit about articulation?
Yeah, and articulation is another part of our speech mechanism. And just like we were talking about the cueing to breathe, that the research shows that if we just cue that loud, that you tend to articulate clearer. And they actually went back and did some research on what if we just tell people to articulate clearer, like really make those point of contacts with your tongue and your lips. That's what articulation is, right? Ta, ka, pa. But they found that cue to be loud had better results than cueing to articulate clearer. But again, when you really yell, like think about, yelling like if someone's going to cross the street and get hit by the fire truck, you over-articulate, right? So that's how that research kind of got into the loud part versus the breathing or the articulation. Does that help?
That answered her question.
Okay.
Thank you very much. Tenasket North Valley Hospital. Okay, and I believe the last one on my list, except for Spokane, is Walla Walla, Providence, St. Mary.
Yes, there are 4 of us, and I have a question. I have a tape correspondence with a friend, and if I talk too long, phlegm builds up in my throat, or I find I have to keep clearing my throat constantly. What do you suggest?
Well, I think probably first off, I would concentrate on, swallowing more periodically during your talking. I think sometimes we are so busy focusing on one that we're not actually swallowing and, working with that saliva. So have a glass of water there and just think about swallowing your saliva. I don't know if you have any thoughts, Dr. Pimentel?
Any other questions?
Yeah.
Kind of like you were saying, you want to keep that good quality, so maybe take a break.
Yeah. Just might be fatiguing a little bit, so take more breaks throughout.
Walla Walla has one more question.
Okay.
Is anything going to be coming to our area, Walla Walla County?
Well, not through this grant, but I'm going to guess you have somebody in that area who's certified in the Lee Silverman training. And Cindy, we can help you locate somebody there.
Yeah, if you contact me and you need help finding out if there is, and I'm like Dorreen said, I'm sure there is, but we can also work with Cadlick down in the Tri-Cities and see if they can help us find one also if we can't. But yep, get a hold of me at the PRC and we'll find the information for you.
Thank you very much.
Well, thank you. Did I miss anybody else out there? Okay, Spokane. Do we have any questions here in Spokane?
Cindy, Spokane has 29. And before we get into general questions here, Dorreen, can you say what is the cost of going through the Lee Silverman treatment, and is that covered by Medicare?
Well, it is actually covered by Medicare. Probably for sure 12 visits. That Lee Silverman recommends 16 visits, and it is highly probable that you can get Medicare to actually pay for all 16. The Parkinson's Voice Project, that's why they went back and did some research on just having the 12, because they knew that would be a better number for Medicare. And then the cost would be, of course, based on whatever facility you go to. And then if you are on Medicare, that copay, that 80/20 copay. Well, I would say probably the first thing he needs is some kind of a alternative communication system. So, a picture board or something. Remember the thing about strokes is typically there's a language deficit as well. So your first thing is we want to get him to be able to communicate at least some basic wants and needs right away. So that's what I would focus on. Can he point to a picture of what he wants? Is he too hot? Is he cold? What does he need? At the same time, then trying to work on getting some voice output and working on that language and speech. That stroke on top of the Parkinson's really makes it more complex, and there's a whole wide range of things that could be going on with the stroke. But he needs some way to communicate. Even if you have family member pictures that he could be pointing to, that would help with some of that communication. He needs to be able to tell basic things. I hurt on a scale of 1 to 10. You could, draw 1 to 10 numbers and see if you couldn't get him to point. So I think, is he getting speech therapy somewhere? Yeah. Shake his head, yeah. And it might take some time, but you want to kind of be working down both those paths of that augmentative system and then the speech and language.
We can't hear. I'm sorry. The microphone's not working very well.
Well, that's really over my head, how the radiation would affect that Parkinson's. Mm-hmm.
And
I don't know what's going to do next door, their voices next door too. We're not hearing anything from their mics.
So I can't hear it all, but you're asking about tightness in the larynx, or?
She couldn't hear either. You ready to go?
Yeah, I mean, it's no different than, the motor problem, right? It's affecting the neurons and the muscles in the same way. It's just affecting, kind of make that stronger. Right. Yeah. And the key too is you want to do it now. You don't want to wait till it gets even softer. You want to do it now so you have that tool to kind of maintain where you are now, versus waiting till the speech even gets softer and softer.
We were talking about.
okay. And Walt, I think, did you have another one? Okay.
She's probably about done.
Yeah, I don't think the microphone's so. Yeah.
More questions.
Anyway, my question was just, does the type and temperature of liquids affect the voice at all? Like, a hot versus a cold, or carbonated versus not?
So do you want to repeat that?
No, she's asking about temperature of liquids for speech itself. It's something to think about. Temperature of liquids, I would be recommending more from the swallowing standpoint, where patients tend to do better when it's really cold or really hot, or it has some flavor to it. But I think in general terms, you want to just think hydration, so not coffee, right? Not coffee. Right. So, you can have your coffee, but you want to be thinking about hydrating, especially if you're doing these exercises. But certainly play with it. See, make some notes and see. We're all different. But probably not coffee when you're doing the therapy. Yeah. Boy, she set you up there, didn't she?
Roger?
Oh.
Swallowing is a problem. I'm taking a medication, and I have a new pill, carbon evidently, and they dissolve. They dissolve. You don't have to.
They dissolve.
It's very new.
So you have a medication now that you're changed over to, that's one where it'll dissolve, so that you, in your swallowing troubles, it's easier for you to take?
Now I'll ask you a question. You have to take the time to swallow. Maybe I think that you're ignoring them. Explain to them why it took a while to answer them.
Yes, absolutely.
Right. You got to swallow first.
Yep. And I think we had one more question, and then we're going to wrap it up for the day.
Can a speech therapist do anything about folks who talk in their sleep?
I hope you all heard that out there.
Just make sure you talk loud, Harvey.
Right. And we tend not to have people not talk. So I don't know. Yeah. That's a good one. Thank you.
So, and actually he ended that very well with a little bit of laugh, because we're still working on next month, and we hope everybody can join us, but it looks like what we're talking, the topic will be laughter and what therapy it does for anybody, but especially those with Parkinson's, and possibly how to start your own laughter therapy group. So we hope that you can join us here in all your sites, because with that last laugh, we have a lot of really good smiles in the house. Also, over the last few months, we've had a little bit of an issue with the videotaping, and if you've requested a DVD and you haven't received it yet, let me know. I may be able to get you a DVD, and if not, I might be able to get you a copy of the PowerPoint, but I will definitely have a copy of this DVD ready. So just let me know at the PRC, Cindy, if you need one. And I think we just hope you go out and have a beautiful day. Speak loud. Oh.
Yeah, I would just like to say one more thing here for the folks in Spokane. Dorreen she mentioned this group speech training that she has every Thursday at the River Point campus. That's free of charge, and that's from 1 o'clock to 2 o'clock. So, if you want to go there, talk to Dorreen. She'll tell you how to get there and what it's all about. And the other thing that she also mentioned was the Tremble Cliffs. This is also free of charge. And this is weekly. We meet at the Rockwood Manor South atrium, and all are welcome to come to that. Okay.
Yeah, I have brochures out there in my business card, so if you want to give me a call and you have any questions, please do that. And the speech group, because we run on the academic calendar at the university, it'll be over the end of June, and then we'll start back up in September. But call me if you have any questions.